Could I have a roll call, please, Stephanie?
Yes. Chairman Brewer?
Here.
Trustee Acera?
Button. One notification. 4:30
Trustee
p.m.
Acera?
Here. Now. Molly Kennedy.
Trustee Doss?
Here.
Trustee Douglas? Here. Trustee Dapsco? Here. Trustee Stratton? And Trustee McCarthy?
Okay, thank you very much. Let's move right into it. First item up on our agenda is the approval of the minutes from our regular meeting on April 28th. Those are in the board packets for the trustees and should have ample time to review them. I'll ask for any comments, modifications, corrections. If there isn't any, I'll look for a motion.
I move to approve the minutes of the regular meeting of April 28, 2025.
Second.
Okay, we have a first and second. All those in favor?
Aye.
Anybody opposed? Very good. We have approval of those meeting minutes. Thank you. Let's get into some director's communications. First up, Steve.
I'll be brief. I just want to point out that we did receive our federal apportionment. I think I sent everybody an email. We were kind of waiting to see what was going to happen with the new administration, but we received our full apportionment, and we actually achieved another stick milestone, so we ended up with more than we had the previous year. So that is good. We'll continue to monitor our state house to see what's going on with the state budget. Transit is a big topic of discussion this year, so we'll see where everything falls. I'm guessing we won't know anything until the very last second because it's regular session. I'm sure Michelle's going to talk about our triennial review last week. They were very complimentary. It was a good process for us. We've got a few things that we think we can improve on, so it's always good for us to take a bigger picture look at what we're doing on a day-to-day basis. I did want to point out that Melissa and Michelle and their staffs did a really good job putting everything together and preparing for that. They didn't have a lot of demands for documents or things like that, like can be the case with a triennial review, because we were very prepared and got them everything they needed in a timely manner. So it went well. We'll have our exit review on Thursday. Again, I'm sure Michelle will talk some about that. And then the only other thing I wanted to point out is that we have begun receiving credits from our solar power generation on the paint and body shop. The solar panels don't power our body shop, but they create an offset. So basically they offset the power that we use from the grid, and then we get a credit for that from CWLP. So that started. I haven't seen the dashboard yet, but I think there is one, so we'll see if there's a way we can integrate that into something public facing here pretty soon. That's all I have for my report, unless you have any questions.
Okay. Any follow-up for Steve?
I have one. Why is there so much more emphasis on transportation in the legislature?
Chicago, they're facing a $770 million budget hole in CTA, RTA, all of that. So while they're doing all of that, IPTA is making sure downstate isn't forgotten about, because we're facing a bit of a fiscal cliff in the next couple of years with the amount of money that's going into the downstate transportation fund inching very close to not being enough to cover what's being taken out. So that's the downstate fiscal cliff. But our issue is about a $70 million issue, not an $800 million issue.
Wow. Thank you.
Any word, any closer on the ceremony over at the...
I have not heard anything yet.
Okay. All right. Anything additional for Steve? If not, we appreciate it as always, Steve. Let's go ahead and jump into finance administration. Michelle?
Yes. In your packet tonight, in the financials, you'll see the investment policy. We annually present that to the board. It's not an agenda item because we have made no changes. I review it, looks good still, so we present to the board in the financial section. So that's in there. As Steve said, we had a town review last week. We have our official closeout next Thursday, so it's not official yet, but we have the potential for a few findings. So we have pled our case. We provided additional backup documentation, so we're just kind of waiting to see what they determine. So they are complimentary, but I wanted zero. So we'll see. I'm hopeful still, but if I have to follow up on these findings, I will. One of them relates to a grant, one of them, two of them relate to procurement, so they're all in the financial section. So which makes it even harder to as well. But it was a good review. It's always good to go through it. We learn, improve. It helps keep us, kind of on track on certain areas. So we always appreciate going through it. You'll see tonight that an agenda item, there's a procurement policy. Some of the things that we have been aware of for a while, plus things that we learned, will be in that procurement policy update. So it's just a good time to refine what we do and what our policies say. But it was a good review. And last week we received 4 new minivans funded by Rebuild Illinois. I forget the month it was presented to the board for approval. It's a state-funded project, and it's replacing 2 Rose Garden vans and expanding to 2. And they are 4 Chrysler Pacificas, and they're nice. I sat in them, I thought, I'd buy it.
It's from state contract.
Yeah, we bought them off the state contract, yes. So it's always nice.
Okay. Any follow-up from Michelle on these? If not, we'll just wait for more on the findings of the review. And appreciate everybody's hard work on that. I know that a lot goes into it, so. All right, then. I didn't see Melissa, but anything from operations? Or?
Yeah, she's dealing with a personnel issue right at the moment. She'll be in here a little bit later. I would just point out that I noticed in the ridership report, the new night service routes appear to be growing, so that's a good sign. Where we've gone from daytime routes to letting those run every hour at night appears to be working well. I haven't discussed that with her, but that's just what I'm seeing from the numbers, so that's a good thing. She's getting ready to start working on the SEIU union contract. That's up. That'll be hopefully before the board next month, and we'll be doing negotiations here starting next week. That's all I have for them.
Okay, very good. Thanks for filling in, Steve. All right, let's jump into some reports, if we could, please. First item up is the approval of the March 2025 financial statements and cash disbursements. Again, as is customary, you should have those in the board packets, but I'll ask for any further discussions on these. If there isn't anything, I'll look for a motion.
I make a motion that we approve the March 2025 financial statements and cash disbursements.
Second.
Okay, first and second, all those in favor?
Aye.
Anybody opposed? Very good, we have approval for those, thank you. Board committee reports, I know we've had a lot of activity, but anything from the finance committee? Nothing today, okay. How about operations?
We did meet last week and had a very nice meeting and was caught up with ongoing things going on, so very helpful.
Talked about routes changing, being very productive in the night. We got I've been getting a lot of compliments about the night routes. So we're very satisfied with that.
Good. Well, obviously, the numbers are reflecting that, so keep that going. All right, thanks for that report. Anything from the administration committee today?
They are both gone. Finance and administration will both meet in the next couple of weeks.
Okay, very good, thank you. Anything from IT steering?
Yes, we had a meeting. It was a very productive meeting. As we know, technology always has advancements and changing. But we had great progress, and I mean we're up there, so it's good.
Okay. Well, I know there's a lot going on from that respect, so appreciate everybody's efforts there. Planning Commission report, Jason.
Yes, a couple things that we're still working on. We've got the public participation plan and the long-range transportation plan out for public review. Those are in places such as SMTD here, the Lincoln Library, and the Urban League, places like that. Those are up for review. We are also then pivoting to a few more projects. We're in the middle of our downtown parking survey. We're in the data gathering process on that. And we have just started to do the beginnings of what is our Safe Streets for All action plan. It's a plan that we need to have in order to apply for Safe Streets for All funding from the federal government. And we also started the process with CMT and Hanson for the West Loop and South Growth project, which is kind of an update of those two concepts of a western and southern kind of loop around Springfield. So that's where, kind of got everything going.
What's going on? All right. Trying to keep up with it all.
Yeah.
Is there an estimated time of completion for that parking survey?
We're hoping to we're a little earlier than normal, which is great, but right now it looks like it's going to be probably in August.
August? Okay, very good. Can you tell I'm excited to get to reading?
I can tell you 43%. That's usually where it is.
All right, buddy. Okay, any follow-up for Jason or anything else here? If not, we appreciate the continued partnership as always. ADA Advisory Committee, David.
Just a couple of small things. We actually met last Thursday, and one of the committee members brought up, I can't remember if it's the inbound or the outbound bus. I think it's probably the number 8 going past the Park Towers development on Allen, and he would like to see them going both ways, not just inbound. But that was a single person's preference. Other than that, Pete and I have talked about going to the transfer center, which I still haven't been to yet, and checking out the signals for I think the buttons for the people who are blind or visually impaired. They're supposed to be able to hit a button and get some information. And so looking to check that out. That's about it.
Okay. Now, when you get over there, we'd love your feedback, so make sure that you let us know.
Sure.
Okay. Anything else for David here? Anybody have any questions? No questions. Okay. Well, if not, we always appreciate you being here, and thanks very much for the committee's efforts. Let's go ahead and jump into some new business if we can. We have a number of things to come before the Board of Trustees there. So first item up is the renewal rates for our FY26 Blue Cross and Blue Shield. I see that we have a representative from Troxel here.
Yes. Thank you, David. Good afternoon, or Brian. I don't know where David came from, but
That's my name.
that's where it came from. Brian, good to see you.
Good to see you.
So, good news this year, and our market has changed, as you're all aware. So we were with Health Alliance for years, kind of being a little bit proactive. Last year, we got ahead of the change, and Blue Cross and the clinic came to the agreement, so we went out in advance of our renewal, and if you remember, we moved to Blue Cross 4/1. So we locked those rates in for 15 months. The announcement came out earlier this year, Health Alliance is closing their doors, which is not good for our market, right? Because now, yeah, I-80 and North, our rates are really good. Metro East and South are real good, but the central part of the state, the rates are really bad due to a lack of competition. So that's going to be even more of a challenge moving forward, losing a regional carrier. So I'm glad that we were proactive and got ahead of that. That's good. We locked those rates in for 15 months. I think there was some concern with people, did Blue Cross buy the business? And they do buy business, and that's a legitimate concern. But again, we locked in for 15 months. So this year, if you open up your packet, starting on the right side, are our current plans and then our renewal plans as of July 1st. So initially, Blue Cross came out and the increase they were asking for was 6.6%. Very good. So national trend, what I talk about with all my clients, is averaging about 10%. So trend is if a group's performing well, right? The cost of doing business roughly goes up 8 to 10% just for that. So coming out at 6.6, I think was very, very fair and easily could have been accepted. But that's not what I do and what we do, right? So we went back and negotiated, ultimately got the 6.6 down to a pass. And then when we add on the additional ancillary ongoing discount, the rates are actually going down. So I joke with Michelle, obviously, we partner with over 1,000 groups. I said, you guys can brag to everybody this year because this is unheard of in our market. And it's been unheard of for some time where rates are going down. So great news. Obviously, we continue to negotiate on your behalf, and we'll do that. That's what we promised many years ago, and this year's great news. Last year at the end, we kind of did have something we had not anticipating. Health Alliance was exiting the prescription drug program for your retirees. So we kind of had to scramble quickly, but ultimately we were able to satisfy that, meet that deadline, and take care of all the retirees, which is good. Okay. This year, again, we're going to have another issue. Health Alliance is going to exit the Med-Sup market. So I've been working on that for some time. I'm still trying to find the best solution and the best price. That's an ongoing dialogue. I was on another call today looking for the best solution for that. But medical's great. Anytime, even 6%. That was a great renewal offer. It truly was. But when the rates can go backwards, we're very pleased with that. On the right side, I know you have a lot to cover tonight. There was a small increase on the dental, like 3%. It puts the employee-only premium up about 40 cents a month, so very, very doable. So really, I know it's always keep it short and sweet. The numbers are good this year, but while I'm here, do you guys have any questions for me? And I know I work with a lot of you in other accounts, so, but anybody or Michelle, anything?
I would like to know why Joe is here. He has been very helpful. We do have a good proposal ahead of us tonight, and Trucks was very instrumental and helpful when we got that news from Health Alliance in the fall. So that was really important. We got to take care of our retirees. It's scary to them when they have changes in their medicals, so that was really very, very helpful.
Thank you.
I was more impressed that you predicted it way ahead of time.
I know, that's good, isn't it? Yeah, it's so sad because, and I know Brian's, that Health Alliance concerned me for years. Mm-hmm. You know, they were, for an insurance company to be receiving financial advice from us, you know, we are brokers for them. That's very scary, you know, and they, unfortunately, were renewing groups they should have let go elsewhere. And, you know, it's really sad. A regional carrier. So, for example, one of my clients, Rochester School District, this year would have been their 25th year renewing with Health Alliance. That's unheard of in my business. That was with one carrier for 25 years, and they're going to have to move after that. You know, but that's the type, having a regional carrier, they really want to work. They want to be part of the community. You know, Blue Cross, we love them. They're good for our clients. But at the end of the day, if they don't write SMTD or they don't write 186, they're going to be fine. You know, and we know that. So we're in dialogue with Aetna, who writes a lot of business for us in Chicago and St. Louis. We're in dialogue with Cigna. We're in dialogue with UHC. We need these carriers to be relevant in this market. We want them to be competitive. We are starting to see a bigger footprint from those carriers. So that's something, even though I'm very happy where we're at today, I'm always looking to the future, what's best for you guys and your employees. So that dialogue is continuing. We are gaining some traction on that front, but we really need to gain a lot more because ultimately, at the end of the day, competition is what can keep the rates down. Okay? Thank you, guys. Good seeing all of you.
Thanks very much, Joe.
Yeah, you're welcome.
Appreciate everything you do.
Yeah, you're welcome.
Nice job on those renewals, too, as well.
Thank you.
Okay. Next item up is our meeting dates for fiscal year 2026.
Maybe I'm getting the folder open. Yes, there's a motion.
Do you want to make a motion on this one? I'm sorry. Okay. All right, then, well, I'll look for a motion on the renewals.
I make a motion to accept the Blue Cross Shield rate renewal proposal for fiscal year 2026.
Second.
Okay, first and second, all those in favor?
Aye.
Anybody opposed? Very good. Yeah. Too many moving parts, Melissa.
I was okay. We're doing well. I don't know what Michelle touched on. I missed her report, but The triennial went well. We have our exit interview Thursday, so we're excited to move into our next 3-year period. We will have, hopefully soon as we get them the graphics on the buses. We should see 4 of our new paratransit vans out on the road pretty soon. So keep an eye out for those. We did get our road supervisor vans, our new road supervisor vans last week. So we're starting the process with getting radios and all the good stuff in them, getting them painted. So I know my road supervisors are ecstatic. Our other vans have put in their lives for the miles. So a lot of good stuff happening. So we're busy as always and a day at a time.
The mentioned the night route numbers increased, the changes.
Yeah. So everything is still looking good with ridership. We actually, if I recall off my fixed route ridership report, we actually are over last year's ridership, of course, and in like single digits under COVID. So we're getting there.
It's an increase.
Right there. We're excited for the changes that we've seen.
Okay. Any follow-up here? If not, as always, we thank you for you and the team's efforts. All right, we'll get back into the new business items. Next item up was the meeting dates for fiscal year 2026. I believe that this year's coming to a close for us, but I don't know, Michelle, do you want to mention anything here?
Presented before you are the dates, July through June of 26. 2 of the months will be on the 3rd Monday, December and next May, because of holidays.
Okay, any further discussion here? If not, I'll look for a motion.
I'll move that staff recommends the board adopt the calendar as presented. Make a motion to approve the fiscal year 2026, July 1, 2025, June 30, 2026, Board of Trustee meeting calendar.
Second.
Okay, we have a first and second. All those in favor?
Aye.
Anybody opposed here? Very good. Looks like we have our calendar for 26 approved. Thank you. Next item up is a resolution regarding a line of credit. We talked about that before, but Michelle, can you give us some more details?
Yes, so 2 years ago, we presented this line of credit to the board, and the current line of credit expires on June 30th, 2025. We are still using the process of debt service through our downstate operating grant, and this, what's in the packet is to extend the next line of credit for 2 years. It's similar to the one that we have in place. It's $2 million. Also in the packet is a list of potential projects that I listed in the DOPE application for 2026. Those are potential projects that we could use that service for. We're most likely going to use them for the Item 5 updates, and Item 5 is related to Clever. It's like the main unit of the Clever system, and we're currently at Item 4, so we need to go to Item 5s. So we're hoping to use that service to fund that project, and then we are also looking at potentially using that service to purchase paratransit vans. Normally we get those through CVP because it's an ongoing state-funded grant. But the ones that just came in, the 8 that just came in, was from our 2022 application. So the program's a little behind, and so we're kind of feeling it now. There'll be another opportunity to apply for CVP, so we'll keep that in mind.
CVP means?
Consolidated Vehicle Program, Plan Program. That in the state has, I think all of our current paratransit vans have been funded by the state. So this is a little out of the norm for SMTD, but we're keeping an eye on our current fleet. There's a current state contract in place, so we would buy off that state contract. We would just use federal funding as well as debt service, so it's both state and federally funded. So those are the 2 things that we will potentially use that service for in the next fiscal year, as well as anything listed in the application we could potentially use it for. But that's what our plans are in the near future. So the line of credit is there in place because debt service allows you to borrow the money from the line of credit. So we borrow the money, and when we pay the loan back, when we pay it back, that makes it eligible for reimbursement through debt service. And that makes it an eligible operating expense. It's a little confusing with all the different operating capital and different things like that, because it's an operating grant for buying a capital purchase, but it is allowable. If we purchase item 5 or if we purchase transit vans, anything we use debt service for, we have to get state concurrence before. So that's also part of the debt service process. So we'll present to the state. We've already started the item 5 have been, we started with item 5 already to request concurrence in anticipation. With debt service, we borrow, we borrow the money and we pay it back like 2 or 3 days later. So we have minimal interest, and that's also eligible for DOPE reimbursement. 65% then is covered, is eligible through DOPE, and then we use our CARES grant, which is an operating grant, to pay for the 35% match. So we're not overburdening our annual apportionment of federal money. Maybe I'm getting a little too in the weeds, but that's basically what debt service is. And the line of credit is through IMB, which it has been in the past as well. Any questions or?
Any follow-up here?
So how many paratransit are we trying to need to purchase?
Well, I think 4, but maybe 6. So we'll see.
4, maybe 6.
Yeah.
What we did with the current 8 that we just got, we of course have 8 new ones, but they were replacement vehicles. So typically 8 older buses that have aged out, met lifetime requirements and years and miles requirements would come out of service and be marked as surplus, and we would get rid of those because we got 8 new ones to replace them. Our paratransit service has grown so significantly. The number of vehicles we have to have a certain spare ratio there so that we're not using all. We have 25 vans, we'll say. We can't use all 25 every day in service because a certain number have to be in the garage getting their periodic maintenance, repairs, that kind of thing. So we're limited to the number of vehicles we can put on the road every day. I can hire more operators to meet daily demand for rides, but if I don't have buses for them to drive, so it was kind of our issue. So we're keeping everything we got. So we have 31 now. I can put more operators out there and try to meet demand. So when we order the new buses that she's going to get, we're looking at expansion vehicles. And at that point, we actually kind of did an expansion now based on need. So the ones that have aged out, when we get those expansions, we'll actually be able to pull them out of service at that time.
Okay.
So it's kind of a delayed thing. So I'll try for 4.
Or maybe 6.
Maybe 6.
You heard.
Try.
Any other questions? I just wanted to add, I can't remember from 2 years ago, did we, the interest rate that we had on the last one, was it on an index or was it fixed like this one that we're running?
I don't know for sure. I'm thinking
I'm
it's
not trying
similar.
to put you on the spot, but
Yeah, I would think it's similar, like whatever, because I just said whatever we did last time, we're going to do this time, basically, so.
it's usually on revolving debt, they'll give you some type of terms that's based on an index or,
I will look, and I'll email you about it tomorrow.
yeah, it's okay. Just anyway, all right, any additional questions? If not, I'll look for a motion.
I make a motion.
Go ahead.
I make a motion to approve the resolution 2025-05 to authorize a debt servicing agreement with a private financial institution on behalf of the district.
Second.
Okay, we have a first and second. We need a roll call on this, please, Stephanie.
Trustee Sarah?
Yes.
Trustee Doss?
Yes.
Trustee Douglas?
Yes.
Trustee Dabsco?
Yeah.
Okay, very good, thank you very much.
Unanimous.
All right, we have approval for that. Next item up is our procurement policy.
Yes.
Michelle, one more.
So this it's kind of been in the works for a while. I was aware of some changes that we've, various classes I've gotten to. So this formalizes them in our policy. Some of the things that we looked at or that we changed, there's a new circular that came out that went from 4220.1F, we went to .1G, so that's changed in there. We updated language to micro purchases as well as advance payments the advance payments are on page 27. Spending limits that we memorialized in our bylaws, I also put into the procurement policy. I updated records retention, BABA, which stands for Build America, Buy America. The DBE, real property and disposition, some of the things that we've learned in the last year or so by going to classes and or going through trying to review, I put those into the policy. So those are all the changes that I made to the procurement policy.
Okay. It's a well thought out document, a lot of work there. We need to stay on top of it, and obviously that's critical. Anything that we need to follow up with regarding this procurement policy? Any questions? Any discussion? Okay, if not, I'll look for a motion.
I'll make a motion to adopt the SMTD procurement policy as presented.
Second.
Okay, we have a first and second. All those in favor? Aye. Anybody opposed? Very good. We have approval to move forward on that. Thanks very much for everybody's hard work. Next item up is a contract to CTI for training room, audio visual equipment. So, Natalie, here we go.
So we've got the ceiling mics here. There's speakers and the TV displays behind you. All of that was pieced together in response to COVID and the need to have the hybrid meetings. Now that hybrid meetings are here to stay, we're looking to upgrade the system. So I solicited a request for quotes. We've got 4 responses that came back in. CTI, whose proposal was included in the packets, came back as the lowest apparent quote. And they included 2 cameras, one of which is a responsive camera. So whoever's talking, it'll put that person as the focus, for good or for bad. We are going to have 12 speakers in the ceiling, so everyone will be able to hear anything that is going on. If we have a remote presentation or we are doing a hybrid meeting, the whole system is going to be controllable from a touchpad that I've been promised is intuitive and very easy to use.
You promise?
And so, yeah, instead of the webcam, we'll have those cameras. So just the quality of everything will be next level, really professional grade there. The total for the system and installation came to $67,267.73. Any questions?
Well, it's nice that we had 4 qualified bids.
Yes.
So it's nice to have a selection.
We're doing this for the board meetings partially, but we also use this room for a number of other things. So this is a training room, so it can be split up and used as 2 different training rooms. IPTA uses it for 3 out of the 4 quarterly board meetings every year. So they have a large portion of the membership of the IPTA boards calling in, and it's a constant problem trying to get all of the technology to work. So usually some of the maintenance IT guys or Tyler can help out and it gets resolved, but this should be a nice addition for that kind of thing. And then also for board meetings when we do presentations like we're going to have coming up with the AECOM, it would be nice to have a more up-to-date, more advanced system for that kind of thing. So it's needed. It was not something we anticipated when we moved over here, but we all grow and figure it out as we go.
Absolutely. Okay, any additional comments? If not, I'll look for a motion.
I make a motion to award a contract to CTI for the purchase of a training room AV equipment for a total of $67,267.73.
Second.
Okay, we have a first and second. All those in favor? Aye. Anybody opposed? Very good. We can move forward with those improvements. Thank you very much. Next item up is a change order regarding our video surveillance.
Yes, so like Melissa mentioned, we have 6 paratransit vans, 6 additional paratransit vans now, and in order to put those into service, there's a couple systems we have to get on them, one of which being the onboard video surveillance system, which is, that project is almost wrapped up. We just have these 6, and then the 2 road supervisor vans will be decked out in new cameras on board the vehicles. So for this change order, it's for the 6 paratransit systems, and then we've also expanded 2 more road supervisor vans. So those will be getting the road supervisor system as well. The total comes to $54,018 for all 8 of them.
Okay. Pretty straightforward. As stated, it's a change order, but I'll ask if there's any questions for Hadley on this. Hearing none, I'll look for a motion.
I make the motion to approve change order 2 for the onboard video surveillance system.
Okay, first and second, all those in favor?
Aye.
Anybody opposed here? Very good, we have approval for that change order. Thank you. Next item up is our contract on GenFair. Could you address that too, Hadley?
Yep, so similar to the onboard video surveillance system, this is for the 6 paratransit vehicles that we're putting in to service. We gotta have fare boxes on them, so this is to authorize those 6 fare boxes.
Very good. Okay, any comments here? Pretty straightforward, I think, so I'll just ask for a motion.
I'll make a motion authorizing the award of contract to GenFair for 6 electronic fare boxes.
Second.
First and second, all those in favor?
Aye.
Anybody opposed? Very good approval for that. And the IT committee's been very busy.
Oh, yeah.
Yes, we have. Oh, we're ready. You got me.
All right, the next item up is our employee assistance program through Memorial.
Yes.
Hadley, you got that one as well?
I do. So the Employee Assistance Program through Memorial Health allows all employees, regardless of if they're on the insurance program, and their dependents to access mental health services through Memorial. The proposed contract locks in the rate for the next 3 years, and we have decent use on it, and they help with everything from like stress management, familial disputes, depression, anxiety, crisis communication. They offer a lot of really great services for the employees as just an extra benefit there.
Okay. Just one question. Do they also like drug counseling or any of that? Or?
Yep, they offer substance assistance with substance abuse.
Okay, thank you.
Yeah.
Yeah, no, it's been a nice addition to our benefits package, so I'd like to keep that going. Good question, Jerry. Any other questions or comments? Karen?
Have we always also made this eligible for family members? I didn't know that, but a wonderful benefit.
Yes.
Do we always have that?
I have to look it up for sure, but I
In the
don't think it
last
changed.
contract,
Yeah,
it was.
Yeah.
We have it currently with Memorial, and they're able to get a certain amount of sessions for every family member as well. So dependents are covered.
That's a wonderful thing, maybe.
Yeah, it really is.
Especially now. For various reasons, we all know.
No, absolutely not. Very good comment, and I'm always impressed by the amount of services and offerings. I mean, it's pretty robust, so yeah, definitely well worth it. So with that, I will look for a motion if there is one.
Make a motion to approve the employee assistance program contract due to Memorial Health.
I'll second.
Okay, we have the first and second. All those in favor?
Aye.
Is there anybody opposed to this? Very good. So we have a motion and approval to go forward with that. And I think that conducts our new business, unless there's anything else under new business that I'm not aware of. But if not, I'll open it up for any public comments. Do you think we have anything out there on the internet, Tyler, or anything else here? Anybody? No? Okay. Well, if there's no further business to come before the board, I'll look for a motion to adjourn.
Make a motion to
You guys want to stick around for a while?
Yeah, second.
All right. All those in favor?
Aye.
Anybody opposed? Very good. Meeting's adjourned, folks. Thanks very much for your participation. We'll see you again next month, okay? Enjoy the upcoming holiday.